Hi guys, this video is going to be a little bit different. It's going to be fairly on the longer side because I want to explain my story straight from the beginning. It's going to be a little more on the rambly side. It's not prepared, so just keep that in mind. So starting in the beginning, in 2011, I was involved in a serious car accident. A driver decided to run a red light, and he T-boned me on my driver's side, which resulted in several torn muscles, concussion, memory loss, nerve pain, all kinds of things similar to that. So since the accident, I've developed several bulging discs, about 9 or so, that came as a result of the accident. And so I've lived with low back pain since 2011. It first affected my duties, but I learned how to live with it. I learned how to cope with it, and I was still able to work full-time, go to school full-time. In 2015, about the spring of 2015, I noticed a sudden increase in my low back pain. And there weren't any discernible causes as to why the pain had increased. We did MRIs, we did all kinds of imaging studies, and I went through physical therapy, but we weren't able to figure out what exactly was causing the increase in pain. Shortly after the pain increased, I also developed a leg instability. So my right leg began just giving out on me when I was walking. There was no pain or any kind of warning. It was just like I lost muscle control right behind my knee. So that continued to get worse, and obviously when I'm stumbling and having to catch myself, that would increase my back pain as well. And so shortly after that, my pain level continued to increase. It was just my low back. And then my left leg began giving out on me as well. So I had to start walking with a cane, and this continued to get worse over time. And then there were some periods without reason why my legs were okay, that I went through small periods where I didn't have to use my cane. And so we never ended up figuring out what happened and what caused the leg instability. But it was just part of the puzzle. We couldn't figure out at the time. We did nerve conduction studies and more imaging to try and figure out if there was a physiological cause, but we weren't able to figure it out at all. And then in 2016, I noticed the pain had began migrating up my back, which was new because the majority of my bulging discs were all in my lower back. So there was that, and so that was different, and so we went to more specialists. I saw a neurosurgeon, UCLA, I saw neurologists, I saw rheumatologists, went all over the place trying to see doctors to figure out what was causing this. And I also noticed in this time, because my pain had increased, I started having difficulties at school with retaining information, solving simple problems, and I just kind of assumed it was because of the increase in pain. So I was having issues with my homework. I attributed the cause of the cognitive issues was just because my pain levels were high. I also had to stop going to school full-time. I dropped down to a part-time student and did the same with work. My job duties changed a lot because my pain levels were so high. I ended up doing, my responsibilities were more sitting down, dealing with paperwork, as opposed to walking around, lifting patients, things like that. And I just noticed everything continued to worsen, and the pain went all the way up to where it was between my shoulder blades, which there were no discernible causes as to why that would be. So at the end of 2016, I saw a rheumatologist, and he looked at me, did some tests, did some more blood work, and I was finally diagnosed with Ankylosing Spondylitis, and that is an autoimmune condition that it's a type of arthritis, and it basically attacks your spine and causes the vertebra to fuse together, resulting in a loss of flexibility in your spine, increased pain levels, all kinds of things like that. And so I was put on treatment, and so my pain levels began to improve, but my cognitive deficits, they continued to get worse. So having the treatment for the AS was nice because it noticeably lessened my back pain, but I never noticed an improvement on any of my cognitive symptoms. They actually continued to get worse the more I continued the treatment for the AS. So it was the early 2017 when I realized that my symptoms weren't caused just by my pain. I remember I was trying to go somewhere and I went to tie my shoe, and then I stopped because I forgot how to tie my shoe. And that was kind of a big alarm bell that there was something else going on. It wasn't just my pain that was just making it hard for me to think, that there had to be something. So this continues on until 2017. In August, I was looking at my blood work, and we saw there were a couple of weird tests. I was getting a couple of false positives for conditions that wasn't possible for me to have. And then we kind of started putting together the pieces, and we looked at the symptoms of Lyme, and we thought it was odd because it wasn't necessarily endemic to this area. So we started looking at the symptoms it causes, and alarms went off in my head, and all of the cognitive problems that I had, that I just didn't have the words to explain what was wrong. I read the symptom list and realized that I had almost every single one of the symptoms. My symptoms were worsening, and then I realized that I should look back and look at my symptoms and see, is that something that's caused by pain, or is there something else going on? And as soon as I realized that there was something else going on, looking back at the symptoms, I remembered thinking, how could I just think that my pain caused everything? My cognitive impairment, I was in a constant, brain fog. I couldn't think clearly. I couldn't solve even simple addition, subtraction problems in my head anymore. I had issues with word recall. I would stop in the middle of a sentence several times a day and forget what I was talking about, and would have to have people remind me. I would have word recall issues in that I would just be having a conversation, I would be talking about something, and I would mention, I wanted to talk about a chair or something, and I knew the word for chair, but the word never popped in my head, and I would stand there searching and try and find the word, and more often than not, I wouldn't be able to find the word, and I'd have to try and use a substitute word to continue the conversation. I also developed just a severe light sensitivity, which is something I have never really had an issue with before, but it got to the point where I had to wear sunglasses inside my house, and if I were to walk by my living room and the blinds weren't closed, and I didn't have my sunglasses on. Just the light coming in from the blinds, even on an evening, would instantly trigger a migraine. And those increased in severity and frequency until I started the treatment for the Lyme. It got to the point where I had migraines almost every day, or migraines that wouldn't go away for 3 days. And I remember it was miserable because I couldn't really do anything. And so that's what started the testing for Lyme. We did some blood work. Some of it came back positive. A particular lab we used was just a general lab. The Lyme came up negative, and so we kind of moved on a little bit. But we looked into another lab, a specialty lab, that was for tick-borne infections, which that's what Lyme is. And so we did the blood work with them, and it turned out that I was positive for Lyme. I was positive for Babesia, which is a parasite. It's a co-infection of Lyme. I was positive for Bartonella, which is also co-infection. And I was also positive for Mycoplasma, which is another co-infection of Lyme. When we did that, we started a conventional treatment for the Lyme disease. Did the standard doxycycline treatment with IV Rocephin, and I improved a little bit, but I still was nowhere near where I needed to be. But once I started treatment, I noticed a decrease in the severity of a lot of my symptoms, which was very nice. But I noticed after the conventional 30-day treatment was over, I was still nowhere near being well enough to return to work or school. I still just had severe brain fog. I still couldn't solve simple problems. My problem-solving abilities, especially in driving, I would notice reaction times were significantly slower. And so normally if you're driving down the road and you're in front of someone who's really slow, and you would peek out to see if there's another driver, and you would be able to make a snap decision, and you would be able to go out and pass or say no, that the other car's coming too fast. But I noticed I would sneak out, and even if a car was very, very far away, where normally the snap decision would be just to go ahead and pass the person, I wasn't able to come to a decision quick enough so where by the time when I decided whether or not I could go, the car was, almost matching the other car on the other side of the road. So it's just dangerous to drive. But things like that, it just, I had short-term memory issues. I had long-term memory issues. I forgot a lot of the medical training I received, reasons behind doing certain things, just like a loss in common knowledge and special knowledge. So that was difficult to go through. But now I've been in treatment since August. It's several months later, and I am significantly better. And you can still see I still stop and pause sometimes, and I still do forget words occasionally, but the frequency is significantly less than what it used to be. People have noticed they can actually have a conversation with me where I don't have to stop all the time. So there is a massive improvement. The problem areas are still the short-term memory and the forgetfulness. I have to write things down when people tell me to do something or have a conversation. I'll still forget a lot, and I still go into rooms and have no idea why I went there, and then would repeat that thing about 5 or 6 times before I would give up. But those are the main issues I have now. I mean, now I can think significantly more clearly. So the treatment is definitely helping, and so the Lyme clinic we've been going to has been extremely helpful. They have helped kind of navigate our way through as I'm not able to work. They've helped with disability paperwork. They've helped. There are certain companies that provide money help as far as medications that aren't approved by insurance. There are several companies that you fill out forms saying that you have a medical need based on your finances or whatever the situation is, and then you can get based on the application you give them, you can get approved or denied. And so they've actually filled out the paperwork so that we didn't have to, as far as all of the private information we filled out, but they've been able to, we were able to send them the paperwork, they were able to send it off in the mail, so we got approved. I mean, they've just done various things like that have been extremely helpful. And we are more confident with them every time we go back. As far as, I've seen several different doctors in 2017 that, based on the symptoms I gave them, said, no, it's not possible that you have Lyme disease. And this was prior to the blood work actually showing the positive Lyme. So infectious disease doctors are generally the doctors who are known for treating Lyme patients. Lyme is considered an infectious disease, so that particular specialty handles valley fever, Lyme disease, things like that. I'd sent paperwork to multiple infectious disease doctors, and they looked at the symptoms and they said, no, it's not possible that you have Lyme. And this was, again, prior to the blood work being done. And then we went to the Lyme clinic in September of 2017, and the doctor we saw, she sat with us, listened to us for about an hour and a half, and she told us that, based on your symptoms, I think that you have Lyme disease, Babesia, Bartonella, and the Mycoplasma. But we'll know more, when your blood tests come in. And later that day, we ended up getting the blood tests, and the blood tests showed exactly what she had said. So that kind of increased our confidence in their ability. And I've hit multiple walls in our treatment since, which has required me to be treated longer. The autoimmune condition doesn't help as far as treatment goes. But every time we've gone back there, she's had a plan for every wall we've hit. She's had an answer for everything, and we've improved after every wall. So that has been absolutely fantastic. So that is the extended story of my history of the medical conditions and the diagnoses. And it's been a huge blessing to finally know for sure what your diagnosis is after 3 years or so of negative tests. So it's been really good to actually know 100% that this is what I have. All right, so that is the gist of the last few years. During treatment, there have been several complications that are not normal. I've had, because the treatment is IV antibiotics, IV nutritional therapies, I have had a PICC line placed. There was some improper management on my end, and it resulted in me going to the ER within a week and a half due to a blood clot I had. We got that taken care of. I had a second PICC line placed. That one lasted for about 2 months or so. and it began developing kinks. It had all kinds of issues that weren't just positional issues, which are common with PICC lines. So I had to get that one pulled, and I had to get a third PICC line placed, and that one lasted all of 3 days. So that kinked up as well, so we ended up having to have a chest port placed. So we spent probably at least $6,000 just in the placement and removals of the PICC line and chest ports. We also, over the summer, to try and help with the pain, because my pain improved a little bit with the treatment for the AS, but it's still debilitating. I'm only able to be upright for a few hours at a time without the assistance of medications. So over the summer, I saw a pain management doctor, and we did all kinds of different treatments. I did end up doing 3 or 4 epidurals. I don't know how many SI joint injections for the AS. We did trigger point injections along my whole spine, and even did therapies called it a Gaines wave, and it's supposed to help with the muscles surrounding the spine. So we did all those therapies numerous times, and they only provided minimal relief, and that only lasted for a couple months. But that was another probably close to $10,000 worth of procedures. So when you're undergoing chronic treatment for conditions, there are a lot of expenses that you don't necessarily take into account. I know I certainly didn't take them into account with how much money we've spent over the years, but with last year doing several epidurals, SI joint injections, trigger points, getting waterproof tapes, shower shields for my chest ports, all kinds of assistive devices, medications. Amazon's about the cheapest place to get the majority of things. All the medication, all the over-the-counter medications and help aids. We've spent probably between this year and last year somewhere between 15, 20 grand on stuff that's not considered just over-the-counter medical things. So I do have disability insurance, and I took out a claim a while ago, and so they were able to apply the disability retroactively. They weren't able to pay a whole portion for my loss of income, but they were able to pay for some of it. So we did receive a check backdating the pay, so that has helped with our existing medical expenses. And so as long as it continues to be approved, I will be getting private disability monthly now. It's not a large amount, but it's enough to help make a difference in our costs. I'm working on state disability now, just waiting to hear back. But even with the disability payments that we'll be getting on a regular basis, it's not going to be enough to cover the coming costs. We've reached the max out of pocket on our insurance, so the insurance has to cover 100% of whatever they would typically. There are still costs that the insurance, there are still treatments that the insurance won't cover because medications, there are multiple medications I'm getting that Lyme is the diagnosis for. They won't cover the costs of that. So some of my IV medications where the daily cost is over $200 a piece for my IV medications, they still won't cover that. So that is obviously going to be several $1,000s, and so they're expecting about 3 more months with the IV treatments. So I mean that is going to be another several thousand that we'll end up having to pay over the next few months. But there's also the fact that I'm not able to return to work in my particular condition. I can't get the treatment for the AS, so I still am physically unable to go to work. So it'll probably take another 3 to 6 months after I'm done with the Lyme treatment to be on treatment for my AS enough that I can actually return to work and start making money again. So, I mean, there's about 6 months or more that I'm still going to have to be undergoing treatment, still going to have to be spending money on over-the-counter medications, on various aids, shower devices, surgery to remove the chest port if needed. That's usually a couple grand. So there are still several costs that you don't typically figure into your treatment. So the disability benefits that we're receiving aren't going to be enough to help us take down all of our medical bills. We are going to be paying the bills. We're probably going to be paying another 10 or 15 grand over the next 6 months. And I won't be able to return to work until about 6 months down the road. And at that point, I'll stop getting the disability benefits. So at that point, after all of the treatment, we will still be making payments on all of these medical bills for probably another 2 to 3 years without your guys' help. So any help is greatly appreciated, and thank you for your prayers and your donations, and I hope to see you soon.